Hi guys, Dr. Lester here, and we are going to be continuing our conversation on blood sugar. And today we are talking about your hunger hormone and cravings and what that looks like. So, typically in blood sugar, we talked about the insulin and glucagon kind of seesaw. So insulin comes out when there's blood sugar on the table, and then glucagon is supposed to come out when there's not blood sugar on the table. When glucagon comes out, it tells the brain, okay, get ready to release ghrelin. Ghrelin is your hunger hormone, and when it's time to release ghrelin, it's time to eat, so the system can get more blood sugar back into the bloodstream. So when we're looking at ghrelin, it's really important to understand exactly what's happening. So with diabetes, we actually never see ghrelin really come out. There becomes a lot of dysfunction because insulin is always out, so glucagon doesn't get to come out, which means that ghrelin doesn't get to come out. And this is significant because that means that the people who who have diabetes are almost never hungry. One, it means that we can't rely on them to know when to eat. So you have to have scheduled eating for this kind of blood sugar mismanagement, because they have no hunger hormone to actually tell them when to eat, and vice versa to tell them when to stop. So it's really important to manage that part. But then the second part is a lot of people who have diabetes they have their hunger hormone suppressed, because this is part of the treatment that we've been given, is to suppress hunger in this situation. Well, the problem is that hunger doesn't come out anyways. We think, oh, it must be because of their overeating. Well, they're overeating because the blood sugar is having high spikes and low drops. So this is the problem, because they're not eating consistently. So whenever they do eat, they have to take it all in, and then we're going to store all of that because we don't know when we're going to eat again, because they can't rely on their hunger hormone to tell them when to eat. So a lot of these people have where they eat only once a day or something like that, and they're fine, and they think, I'm not hungry. I don't know why I'm overweight. I don't know why I have these blood sugar issues. I'm not hungry, So this is not a reliable thing, and it's even worse to then go suppress the hunger hormone, which is already having a whole lot of issues. So, because then you're just kind of exacerbating that stay in insulin mode, which is just insane to me. It's just insane. So part of the way that we treat this is to eat on a schedule. You have to eat whether you're hungry or not. Even if it's just a little bit, I need you to eat something. Second thing is that it has to be fat and protein, because we need to have you stay full for a little bit longer to hold in between, so it'll stabilize those blood sugar spikes, and that's really important here. And the third is you definitely have to start with breakfast whether or not you're hungry, because that is going to break the fast of the nighttime. So it's important to start that time frame and break that fast. And lastly, it is important to, every time that you actually are hungry, to encourage that hormone. So we're actually going to eat every time we're hungry, because that is the appropriate pattern, right? We get hungry, we eat. We get hungry, we eat. So we're going to encourage that every time that you do have hunger. And that's going to slowly help the hunger hormone come back. Now, cravings are slightly different. A lot of the times cravings are related to a specific mineral or vitamin deficiency, but they can also be related to blood sugar. So for example, if you're craving something sweet, it's usually because your blood sugar is a little bit too low, or you're having a drop in that moment, or it's just being mismanaged. So or you're seeing it as a very stressful moment, and that's why you need extra blood sugar, because your body is designed during stress to crave extra blood sugar. So then during those moments, you're going to crave the Snickers bar, or the juices or whatever, just high sugar that you can get. So those are also going to be managed by helping to maintain this balance, and by eating appropriately on schedules and trying not to break that unless you actually feel hunger. I hope that helps, guys. I know it's a little bit complicated, but we're really managing this poorly, and it just doesn't make any sense to suppress hunger hormone. If you have diabetes or blood sugar mismanagement issues, you should be encouraging when your body is hungry. All right, guys, hope that helps. Thanks.